when we have problems like transverse plant foot. The size, if we speak that the first and fifth metatarsus bone are pressured and after and others must present more upperly than this. In this situation, what's happened? Fourth, third, and second metatarsus bones caps go down. They try to find some space in the transverse arch. And what's happened finally? The presence of these calcaneus bones caps increase the size, the transverse size of the foot. That's why the first toe and the first metatarsus bone dislocate in the valgum deforming. That's why, and the finger starts to present in the varum deforming. That's why we start to check these problems, and after that, sorry, after that, so high pressure in this area guaranteed that we start to see the osteophytes here. You see what's happened with the first talus phalanx joint. You see that we have decreasing of the joint or narrowing of joint space. We find the subchondral sclerosis. We find the bone spurs. I think that you agree with me that I told you about this few weeks ago when we described the osteoarthritis topic. That's why the osteoarthritis happened this too. This is these pictures, these two pictures, this and this, in Russia, have any X-ray doctors which describe the lateral and frontal projections of the. Sorry, 1 second. Who is it? Да. Я читаю лекцию сейчас, через час. Sorry. And when they examined these grades, sometimes the doctors forgot about these grades. And you, when you pass the exam, after that, you forgot. And maybe if you choose the X-ray part of medicine like yours, I think you have a modification of these information on your working places. Like this, you decrease the longitudinal arch, and like this, you decide what's happened with the transverse arch because the arcus, because this angle or angle of the valgum deforming of the first toe give you the degrees of hallux valgus. And in this situation, you see in this slide, you check the grades of them. That's why if this angle more than 25, we must name that the patient have a longitudinal flat foot with the valgum deforming of the first toe, third degree. Photography. If we speak about the methods when we examine them, when we use an exam, that's why we must use a podography. We must use the dynamometer platforms and pedography. If you want to, when you ask your patient about the complaints, usually the main complaint of your patient is pain. It's a stiffness in the feet. Sometimes in the morning, sometimes the stiffness decrease per day, and usually in evening. If you examine the child with these problems, usually they told you that doctor, I can't play, for example, in football. I can play in other games because I tired so fast, and other boys process to game, and I can't do that. If we speak about the plantar valgus deformity, etiology like others, it's a paralytic, it's a problems with muscles and tendons, it's a post-traumatic problems, it's a rachitic, it depends by the problems in a German phone and static. That's why what's happening. Position center of the axial load here is not the same like in the normally position. That's why we have a torsion of mid area of the feet, and like this we have a plantar valgum deformity. How you can understand it? You must make the X-ray and check the position of all of these spots, and that's why if you see that this angle increased, you understand that your patient have a plantar valgum deformity. And the plantar valgum deformity depend by this balance: fibular muscles and anterior and posterior tibial muscles. That's why this tension attraction guaranteed that have you any rotation or torsion in a lateral or medial side. That's why the most oftenly cause of plantar valgum deformity, it's a problems and it's a paralytic type. What's happening in this situation? You see that normally in the calcaneus area we have near than 3-grade deformity on of the ankle or tibia axis. In this situation we have more than the 10-grade adduction, and that's why we must name that like pes valgum or pes varum, depending on which side we have this deformity. The clinical signs, it's like previously, it's a pain, stiffness. Sometimes after hard working or too much of active activity, we can find the physical activity, we have the edema. You check how it's see in the child legs. You see that we have, I think that 25 grades of lateral deformity. That's why we have a deformity of feet. If you want to check, if you want to understand how it's happening, it's this flat foot here, because when we change, that's why we understand that the patient have not any longitudinal arches, and that's why if we made the plantography for them, we check this picture when all surface of the foot are pressured. This is the degrees of this situation. It's normally it's a first, second, and third degrees. This picture describes us how it's seen on a plantography. When we have a normally axis of ankle joint and the foot, we see this picture. If we see no more than 6th grade, it's a maybe near than physiologist condition. If we have a valgum deforming, you see what's happening. We lose some stepping area, but we have so high pressure in the distal part of the foot. That's why we start to check another one, the transverse plant foot too. If we have 6th grade valgum deforming, that's why what's happening. We see the higher pressure here, but generally these kinds of deformity more better than second. If we have a normally, but we have so high tension of the fibular tract of the muscles, what's happening? We lose the transverse arc or longitudinal arc, and if we have a valgum deforming and so high tension of the fibular tract, we see the valgum deformity of the foot. Treatment. Oh, it's a great problem, students, I told you, because it's a so long process without any fast results, without anything, and with a great work with the parents. Don't forget that if you choose the medicine, if you choose the pediatric kind of the medicine, you must understand that you treat the child and you treat the parents too. And that's why you must prescribe the patient's massage, warm bath, different kinds of exercises. You must make the special insoles and change these insoles every season. Why? Because don't forget that the child's grow. That's why her foots grow too, and the size of these shoes increase too. and you must, this child must have every season new orthopedic shoes. You try to reduce this disbalance from the tibia and fibula muscles by the electromyostimulation of muscles. You recommended to walk on the beach with the barefoot and some others, and you don't find any fast results. This deformity non-reduced after few months or few weeks. And I told you about this. It's some special orthopedic insoles, and in which period, by doctor's opinion, we must prescribe the child these kinds uh, of insoles and any measures of I forgot this term in Russia too. Oh, usually we decide like this, that before 8 years old, we can discharge some problems by our patient. After 8 years, all problems starts to get a static component into her pathogenesis, and we can make them. We can do anything for the just operative reconstruction. Girls, don't forget that the heels, it's so cool, it's so sexy, but just no more than 4 centimeters. Other these heels, 11 or more, yeah, you can use that, but please, let's hear some orthopedic doctor from Russia. Let's use this just on the holidays and some other, not so often, because the high heels change maybe give to your foot too much of static deformation, and if you use this from so young age, I told you, and you have some mothers and grandmothers with the problems of the foot, these problems guaranteed for you too. You must use the insole supinators, and you must buy the comfortable shoes. Like orthopedic, I recommend it for you like this. If you want to buy any shoes, let's pay it for the technologist, non-pay just from externally seeing of your feet. It's a different techniques of the operations and some others. No, I give you all of you. You see my picture, my video, yeah?
Yes, sir.
Now I present it, maybe it's my working place. I'm present in my home. And sometimes I forgot to show some for my students. Here we have the different kinds of, different kinds. I don't want to tell you about this just. I want to tell you like this. Who was being my students? You check that I absent some time in the classroom because I operate. I'm a surgeon and I work in the department. And the main part of my medicine now, it's some endoscopy operations on the joints. But I have another one lovely topic of orthopedic surgery. It's operations on the distal part of the foot. And here in this lecture, we have too much of the pictures about the different methods of the foot treatment, operative. But today we try to decide that with the chief of my department, with my teacher, about the philosophy of our education and what information we must give for our students. I think that you don't need the name of this operation. You don't need some ideas of this. If you want to choose the traumatology like your parts of medicine in the future, you can read about it. Why? Because I have some special book. I show you the size of them. This book is just about the distal part of the foot and just operations. Into this book, we have a describing near than 400 different modifications of foot operations. I don't know all of them, and I'm a traumatologist. In my opinion, if you choose the maybe general medicine and some other, you must understand which X-rays you must make. You must make the primary diagnosis for your patient with the different problems of the feet, and give your patient the consultant of orthopedic, because you check how much of different things. And I told you like this: when you have this question in the exam day, you must tell me if I examinate you, I want to hear the causes of the plan of the food problems. I want to hear some complaints. I want to hear the so acute areas which usually deformed in different kinds of deformity, and general principles of um, reduction in souls and some other. I don't ask you about the operations. I don't ask you about these things, how you made the approach in the first story and why you decided you choose this operation into this. But I show you some pictures for the girls usually. If you have some problems, I maybe can ask some elections. Girls, whose of you made the pedicure? All of you, yeah?
Probably.
Mhm. And tell me, please, whose of you cut the so soft, maybe skin here in this area, in a posterior, in a foot surface here, in operation of the second, third, and fourth metatarsal bone?
I don't.
You don't know. But if you do that, my congratulations, that's why you have some problems with your transverse arch. Because before this, in a few minutes, I told you that we have just two pressured areas here. It's a distal cap of the first and distal cap of the fifth. All of these things, it's on pressure. And if you have the skin like these women, that's why you have some pressure here, and that's why you lose the transverse arch in the future. If you don't use any insoles and any other things, you have some problems like this woman. I think that first of all, her complaints, it's a cosmetic problem. She must buy the more higher shoes. She must use plus sizes, because you check the transverse size of her right foot so big, and they are not the same in the left side too. That's why it's a great problem. And if I ask you, students, which operation you want to choose in this situation, I don't do this. I don't make these questions. Why? Because no traumatologist can answer all my question. And let's decide like this: you are students, you are not a postgraduate orthopedic doctors. If you uh, if you decide that you want to be a traumatologist in future, okay, you have my email, you have my Zoom. That's why let's send me some pictures and let's decide and make the diagnosis, and let's plan in your operations. In these situations, no. But you check that we have osteophytes here, that we have osteoarthritis too. And which operation we made in this operation? For example, I told you, Shade, scarf osteotomy, Aiken osteotomy, veil osteotomy, and Goman arthrodesis. Orthopedics, understand me. Relax, you are students. It's a more higher level, you must understand why these situations happened. You must name all of them. You must make the well examinations, X-rays, CT scan, maybe sometimes MRI, and that's all. If you are not a traumatologist, that's why let's relax. It's a problems post-operative foods because you see that the size of the first. And this situation and this picture I don't want to show you because you can speak about this in a child surgery department. That's why, sorry, I made the short lecture, but first of all, it's your last lecture in our department, and secondly, my apologies, it's so difficult for me to speak so long time. And you want to relax too? We have just 57 persons, not so much. Have you any questions to me, students? Gabriela?
No, no.
How much of you present in Russia now?
I don't know the numbers, sir, but I believe the major part.
In
over
Russia?
70.
Mm-hmm. Okay, that's why let's see you in the exam day in June. I think so. I have not the schedule. Let's relax and let's prepare like a well students, like a not so and non like a non so good doctors. We are not asked anything from space on our exam day. And if you understand the main process, if you understand the main philosophy of traumatologists, I think that all be well.
Thank you, sir.
Take care of you and see you in June.
Take care you also. I hope you get better soon.
Thank you. Thank you. See you.
Thank you, sir. До свидания.
Thank you, sir. До свидания, sir.